If you enjoy psychology content, subscribe to Psychology in Minutes for more. Have you ever noticed how, for some people, the week before their period feels like an entirely different reality? Small inconveniences suddenly feel unbearable. A harmless comment can trigger tears. Exhaustion hits like a truck, and even getting out of bed can feel impossible. Many people casually call this PMS, but for some, it's far more intense. Today, we're exploring Premenstrual Dysphoric Disorder, or PMDD. We'll cover what it is, why it happens, how it's different from ordinary PMS, and the burning question many people desperately want answered: is PMDD really just bad PMS, or is it a legitimate mental health condition? The answer is absolutely not. PMDD is a serious and very real disorder. PMDD is a severe mood disorder linked to the menstrual cycle. It typically occurs during the luteal phase, the 1 to 2 weeks before menstruation, and symptoms often improve dramatically within a few days after the period begins. Unlike PMS, PMDD can significantly disrupt work, relationships, and daily functioning. Psychologically, PMDD isn't caused by abnormal hormone levels. Instead, the brain has an abnormal sensitivity to normal hormonal fluctuations, particularly estrogen and progesterone. Think of it like an allergic reaction, not to pollen, but to your own monthly hormonal changes. A popular example can be seen in the film Midsummer. While not explicitly about PMDD, Danny's overwhelming emotional dysregulation, sensitivity, and feelings of instability resonate with many people who struggle with severe hormonal mood changes. Common symptoms include intense mood swings, sudden sadness, irritability, anger, hopelessness, severe anxiety, difficulty concentrating, fatigue, changes in appetite, insomnia or hypersomnia, and physical symptoms like bloating or breast tenderness. For example, someone may feel perfectly fine 2 weeks out of the month, then suddenly become deeply depressed, socially withdrawn, and emotionally overwhelmed right before menstruation. This cyclical pattern is one of PMDD's defining features. There are no official subtypes in the DSM-5, but symptoms often cluster into 2 patterns. Some people primarily experience depression, hopelessness, and fatigue. Others mainly struggle with irritability, rage, and anxiety. Many experience both. The exact cause isn't fully understood, but serotonin appears to play a major role. Genetic factors also increase risk, especially in individuals with a history of depression, anxiety, or trauma. Now the burning question: can PMDD be cured? There is no permanent cure, but it can be managed extremely effectively. Treatment often includes SSRIs, which can work surprisingly quickly for PMDD, sometimes within days rather than weeks. Hormonal treatments, including certain birth control pills, may also help regulate symptoms. Lifestyle changes can make a significant difference. Regular exercise, adequate sleep, reduced caffeine, and stress management are often highly beneficial. Cognitive behavioral therapy can help individuals manage the emotional impact. For medication, consult a psychiatrist or gynecologist. For therapy, a licensed clinical psychologist is ideal. Support from loved ones matters immensely. Instead of dismissing symptoms as just hormones, validate the experience. A simple, "I know this is really hard right now," can make an enormous difference. PMDD is not weakness. It is biology colliding with psychology. And with proper treatment, stability is absolutely possible.